Thanks, Miles. I appreciate all of you hanging in there. I'm sorry we're about 10 minutes late. We just ended the last conversation briefing with the elected folks. And of course, this will be our last one with all of you. And let me just start by saying thank you to all of you who have been here throughout the last 15 months and really been a partner with us in getting our those very, very important messages out there, and certainly asking the hard questions too. It's your job. That is your job. And we certainly appreciate that and try to get the answers to you. It's all about transparency to us. We want to be as open as possible and get information out to the public. That is important. So let me start the way we normally start. I'll go through some of the statistics here. Sorry to report that we have had 6 more deaths since the last time we met. And we look forward to that day, of course, where we can report no deaths. And we hope that that day is soon. As we look at now, we've approached just over 42,000 people who have been infected with COVID-19. The good news is our hospitalization rate remains low at 8. And it was certainly see better days in front of us. As of when we talk about great days, we hit a milestone, a memorable milestone on June 2nd, when no new COVID-19 cases were reported. And that's the first time in a very, very long time that that had occurred. So it is very encouraging of days in the future where we will see no cases, and we look very much forward to those days. Just a reminder, June 15th, the tier system will go away, and we will move on to a new system. And just by way of reflection, we can see where we had been many, many months ago, 6 months ago. And as we look today at the adjusted case rate of 0.7, just a reminder of 6 months ago, where our adjusted case rate was 36. Our positivity rate is 0.4, which is outstanding, and the unadjusted case rate is at 1.3. Vaccination update, supply is obviously extremely sufficient to meet demand. There so much so that we will take down any barriers of residency or work requirements in the near future, that anyone, no matter where you're from, if you're visiting here and you want a vaccine, we will get that to you if you show up at one of our clinics. We're moving to more predictable vaccine clinics happening each week. Locations and sites throughout San Mateo County, especially in East Palo Alto, so people can rely on the fact that maybe I couldn't make it this week, but I know it'll be there next week at the same time. We'll continue to facilitate and expand micro-targeted pop-up vaccine events. And for anyone who wants to have a micro pop-up event, we will accommodate that. There's a form online, say it's a church or an organization or a group gathering. We've been very successful at the fair, at the county fair. We had over 500, I believe, over the weekend, and we will be there today through Sunday issuing vaccines there, or any other type of event that pops up. We will be there to put needles in the arms of individuals who want the COVID-19 vaccine. We're also encouraged by the fact that the pediatric providers are now more and more getting the vaccine in their office, and we hope that that continues. And someday, especially as the age group moves down for vaccinations. The most important thing that I think that we can talk about is the milestone that we're about to hit fairly soon, and that is the 1 million dose mark. We're at 978,000 doses right now, and at some point we hope to go over 1 million. That's about 84.8% of eligible adults 16 plus who have been vaccinated, which is tremendous. And we've also seen now that we've reached 71.6% of the eligible adults in our lowest HPI index, census tracts, which is a 13.2 percentage gap, but that is encouraging that that number is still climbing. And we have reached 82.9% of 12 of our 12 plus population, 52.3% of the 12 to 15-year-olds. And we can see the data dashboard that 117,000 residents 65 and older have been vaccinated at 75.9% and 71.4% of 75 and older. So San Mateo Medical Center continues to use HRSA supply of vaccine. Vaccinations continue daily at the clinic locations, and HR support continues weekly hospital clinics in Daly City and Fair Oaks health centers. Second doses, we've got some of those going on at the SFO parking structure. We have dismantled the event center, and we'll be no longer doing mass vaccinations there. And as soon as we get through these second rounds at SFO, we will be dismantling that because we believe that the micro vaccinations opportunities are where we need to be right now. So today marks the final briefing and the final hours of that we've spent together. But I could tell you again that it's been absolutely incredible having you here. And I'll just, if I could, if you indulge me for just a couple minutes, I'll run through some of the kind of the history that we've been through together as a way of reminiscing where we have been and where we are going. So if you remember way back to March 2020, COVID-19 had been in the news for weeks, and the World Health Organization declared a global pandemic on March 11, 2020. The county opened its emergency operations center, staffed dozens of county workers at that time. Passengers on the Grand Princess cruise ship were quarantined at San Carlos Hotel. In a lot of ways, it seems like yesterday that occurred. In a lot of ways, it seems like a lifetime ago, but it was amazing that where we've come from since then. Gatherings grew smaller and smaller. March 17th, the Bay Area health officers ordered a 3-week shelter in place, which would eventually stretch through months, shuttering most of the county's 21,000 businesses and sending 385,000 employees home throughout the county. And then we all remember back when those streets were deserted, and it was eerily deserted in a way that we couldn't imagine. Schools, 95,000 students were sent home to learn remotely. Workplaces, including government entities, began learning how to navigate in a virtual world. And at that time, the 6 counties reported a combined 258 COVID-related cases and 4 deaths. Compare that to where we're at today of over 500 and 579 deaths, with over 42,000 people infected in our county alone. The preparation, the first priority was keeping the community safe as we tried to understand this virus with the rest of the world. The county solicited donations purchased through for PPE while we tried to go out and purchase and compete with the rest of the world to get PPE. And that was something I hope that we never go through again. We stood up the 211 information line and handled 5,200 calls. County council staffed and manned a call center to answer questions, legal questions and questions for individuals, and trying to interpret what was open and what was not open. 250 medical beds and equipment were set up at the event center. And speaking of the event center, what an incredible job they have been, and what an incredible resource they have been to us for testing and vaccination and setting up these beds and storage of the PPE, utilization of their personnel who needed to pivot very quickly. An incredible, I just can't begin to explain what an incredible resource that event center is. Alternative housing, the health officers were early identified the need to isolate those with COVID-19. We were the first county to set up a COVID hotel where we could decompress the hospitals and put people into a less step down setting that they needed, with the doctors and nurses who could take care of and get them to the healthy point. A total of 1,110 guests stayed at alternative housing locations. And the most prominent was in Burlingame, with 221 total vulnerable residents received healthy meals and medical care. And we closed down that facility in late 2020, but we still have great need for people living in hotels. And I don't want to give anyone the impression that we're at the finish line and we're saying that COVID is over. We've got a long ways to go, but we are beating this and we are recovering at this standpoint, at this point in time. And that's the good news, right? And it's all these efforts in the past that have got us here, though we know that COVID is still with us and we've got a ways to go. After that, the next major milestone was testing, all the testing we set up. And in those early days, we set it up and the demand outstripped the resources that we had there, but we adjusted and we put more out there. Again, we were one of the first counties to do drive-through testing in the entire Bay Area on a mass scale. And the testing metric obviously became so important to us. We have been number one or number two in testing in the state for many, many months, and that is something to be celebrated. We need to maintain testing to understand the variants. We need to understand how prevalent it is in our community. So that's why it still remains out there and is easily accessible. On the vaccination side, once again, once that became available, the first doses were administered on December 18th, 2020. We were the first and probably the state to stand up mass vaccination drive-throughs. We had people coming from all over the state to see how we were doing it, first at the event center and then at SFO. And that allowed us to get many, many people through quickly, though the supply remained a constraint to us getting a lot of that done. And now we're at the point where we're decommissioning those. And that's a great sign, something that we couldn't have imagined a mere 6 months ago. And in regard to our community engagement, particularly during the shelter in place, the JIC, Michelle and her staff did an incredible job here at the county. And Preston is here with us too from health and celebrating our last day together. They actually showed up here. This is awesome, having them in the room with us. But what an incredible job they did disseminating information and double checking that and triple checking that information to make sure that it was accurate. They did such a great job in launching the comeback campaign, the positive campaign managed by the JIC, aimed at to unite residents, that we were all in this together and that we would get through this together. The campaign resulted in more than 15 million impressions across the channels. Really the theme of that and the tagline was, our comeback depends on all of us. And it certainly did, it certainly has, and we have all been in this together. The Office of Community Affairs worked with 34 trusted CBOs to get the message out there and help disseminate county information. They distributed almost 50,000 masks, and they provided on the ground 220 canvassing events for community vax. We also put in the compliance unit. We literally did that overnight to make sure that businesses complied at the critical stage of COVID-19. And they did a wonderful job working with businesses to understand what they could and could not do, and then take enforcement action against those who violated the trust and public safety of this community. In the recovery effort, really in the early stages, we talked about recovery almost from the beginning, that we'd have to get together very early on and plan for recovery. And you can see that all the money that has been distributed as part of this recovery, and as we still plan in the partnerships, and the San Mateo Strong grants provided one-time emergency grants to families, nonprofits, small businesses, childcare providers, and others impact. And then certainly the success of the SMC Immigrant Relief Fund, 25,000 applications, 15,000 grants for 15.7 million. Special funding through the Children's Health Initiative allowed 2,000 second round grants. And then the board certainly imposed the eviction moratorium and the SMC Recovery Initiative has been in collaboration with more than 160 local government agencies, community-based organizations, nonprofits, private partners, and residents to promote inclusive recovery. And that has resulted in $163.5 million in total COVID-19 relief funds. Amazing number when you think about it. So what does the future hold forward? The short answer is, I think that in a lot of cases, we don't know. We don't know where this is going to be in the upcoming months. We hope that we will be well on the road to forgetting what COVID-19 was to this community, and well on our way to never having another death from COVID-19. But that remains to be seen. I can tell you that county will fully align with the state's planned reopening of June 15th. The county EOC remains operational and stands ready for any future surge. In our work, and I mean that all of us out there, is truly far from over. We will continue to sprint through the finish line till COVID-19 does not exist in this county. We will sprint through the finish line to make sure that people are taken care of in need of help, who are either in need of housing or have food insecurity, or need to start up that business. We are on our way to recovery, and that is the good news. We are a stronger community. We are a stronger county for having gone through this together. And we are poised now to face any type of crisis with the knowledge that we have gained and the collaborations that we have forged throughout this last 15 months. Our CBOs have been outstanding throughout this. Just a little bit of news. I'm sure you've all heard that the Great Plates will officially end on July 7th, 2021. There will be no other extension beyond that. We will pick it up through the end of the month, and then we will refine it in a way that makes sense going forward to make sure that those seniors with food insecurity, their needs are addressed. And we will continue to conduct our outreach. As a county government, we will open on June 15th. Open all our doors on June 15th. So with the ERAP housing funds, just an update on that. Applications processed are 978, total active cases 1,978, total rent requested with utilities is 27.5 million, a fraction of the money that we still have. The total rent requested is 25 million and the utilities is 1.4. And total funds pending approval, 8.96 million. Total rent paid, 2.17 million. And the county is waiting to hear on proposed policy changes for SB 91. We'd love to see that extended. The board passed a resolution to that effect yesterday. We believe we need more time to reach more people in order to make sure that we wipe out this incredible debt that people are under from the inability to pay for their housing. So we're hoping that the governor will take that up and that will be passed forthwith. Just in closing, I just want to say that, I've really enjoyed getting to know a lot of you. I'll certainly be available anytime you all have questions. We really considered this a partnership. We needed information to get out there, and you guys did a wonderful job of doing that, of informing the public, and again, of asking those hard questions. We have tried to be completely transparent in everything that we've done, and we couldn't do that without you being that conduit to the public. So thank you. And with that, Miles, let's see if there's any questions.
So I see Henrietta's hand up first.
Henrietta, I would expect nothing less, and I would be surprised and disappointed, quite frankly, if you did not have a question for me on our last meeting here.
Mike, thank you so much for being there to answer the questions. It's been a long journey, and I will miss these press briefings. In the meantime, I have two questions. Number one, there seems to be an abundant supply of vaccines, and Some communities or some areas of the country are talking about excess vaccines. What will happen with the excess? Will they go to waste? Will they have to be destroyed?
No, I think they'll be redirected. And I think that the state's been doing that for a while now. And quite frankly, the country's been doing that for a while now. I just don't see many of these doses ever going to waste. There's such a demand, not only in this country, but outside this country, that that I think that they will figure out a way to get these doses to the people that need them. And I know that we're not probably fully drawing down on all the doses that we could avail ourselves of because of the need. So we're not asking for more than we need right now. We're doing this very consciously in a way that we understand what is needed for the events that we have planned in the near future. And that's obviously become less and less as we get the higher percentages of those vaccinated.
Thanks. I have one more question. Pfizer seems to be getting closer and closer to having a vaccine for children. It seems getting close to approval. And I'm just wondering, will the county have to set up a different infrastructure? I would assume the county will be involved in whatever dissemination, distribution needs there will be getting vaccine to children.
Yeah, absolutely. Well, I mean, we'll be involved in that, but you know, the nice thing is that Pfizer is making it easier for pediatricians to have those doses right there in their office in, you know, in just regular refrigerators. So that is something that's transpired as of late that allow really a whole different segment of society to go in and get a vaccine. And quite frankly, parents may have questions about it. So I think that's a totally appropriate place to for them to confer with their doctors and get those vaccines. Preston, I don't know if you have anything else.
No, I think you're exactly correct. It'll be really borne by the pediatricians in the healthcare system.
Yeah. Yeah.
So would the county be setting up distribution centers in schools or?
I think certainly we could.
Schools,
I think,
like drop points or
I think
clinics?
yeah, I think certainly we could, like we have in with the 12-year-olds. But we'll have the ability to do that in the clinics that we have. But I think there'll be many more avenues also, Henrietta, to try to get those individuals vaccinated. Some parents at that age may feel more comfortable taking their child to their local pediatrician and getting it directly from them. So, but we will be certainly involved in that process and available also. I would imagine if a parent wanted to bring a child into a clinic, we would have that availability also. So
Thank you.
look forward to that day.
Great. Sarah.
Sarah, how are you?
Good. Thank you all so much for all your work over these last months. I just want to ask about the reopening coming up, specifically about individual businesses within the county. If they want to enforce stricter rules like mask mandates, can they do that? And how will that enforcement look? Will it just be up to them to make it happen?
Yeah, you're absolutely right, Sarah. As you know, Cal OSHA is still in flux right now in what they're going to do for employers and employees in those businesses. But it's going to be totally up to the individual owners as to what they do in regard to the customers that come into their businesses. We will not get involved in that. We're going to be following the state from, you know, as we have been in the past, but we'll be following state guidelines along those lines and not making any separate orders in the county.
Thank you so much.
Okay.
Great. We have a typed up question from Sierra, which is, what are some ideas of how the Great Plates Delivered program will be modified or may be modified to continue providing this meal support to seniors after funding ends in July?
Yeah, I think that we really need to understand who are the most vulnerable. We've got right now, I think, over 4,000 people from throughout this county and literally every city and town in this county. And we have to really understand those are the most vulnerable. Right now, they're getting 3 meals a day. we may modify that in some way. But we will be much more targeted in our approach and really much more understanding of the population that needs services as we move forward.
Great. I don't see any hands raised, and I don't see any other questions typed in at this point in time.
Great. Thank you all. I really appreciate all that you continue to do. Stay safe out there. It's been a journey with all of you for the last 15 months or so. And again, I just really appreciate all you've done and will continue to do. Take care. Stay safe.